St. Luke's Medical Center, a healthcare institution with 2 hospitals in Metro Manila, says its COVID wards and critical care units are now running at full capacity. It adds there are also patients in critical condition waiting for urgent admission at emergency rooms. We now speak with the center's Chief Medical Officer, Dr. Benjamin Campomanes. Good evening, Doctor. Thank you for joining us.
Hi, good evening, Mike.
Doc, can we just get an update first on the status of your COVID wards and your ICU rooms?
Yes, first, thank you for having us in your show. Actually, the capacity is very fluid, it's very dynamic. So I just got this is very recent information that in Quezon City, actually, we have now full ICU, but we have no ICU patients in the ER. However, there are 4 patients waiting for in the COVID rooms and COVID wards. For Global City, we have now 6 patients waiting for an ICU bed, and we have only 2 waiting in the COVID general nursing units. So that's the statistics and data as of the moment.
Doc, can you tell us about your manpower? Are there any problems at this time? And are there any reports of infection among your health workers?
Yes, good thing you asked me about that, because then the headline, which I was surprised, was resignations of healthcare workers hit St. Luke's Medical Center. And, the headline is very deceiving because it puts out, it puts a wrong context on what resignation means. When we say resignation, we do have resignations every month. In fact, our attrition rate is we get about 25 to 26 resignations a month, because these resignations of our nurses is because they are accepted to go to the United States, to the United Kingdom, and other places where they are accepted to work abroad. So this is not very unusual for us. Since pre-pandemic, we've had this number of nurses resigning. So this is when you say hit St. Luke's Medical Center, it's as if they're resigning because of the pandemic, but actually they are not. With regards to the quarantine, yes, this becomes a problem, because if we have some nurses, because we're doing mass testing now, we're testing everyone, and we see a lot of asymptomatic nurses coming in, and then they are exposed to some people, some other nurses in their dorms. And so we have to quarantine a lot of people. And that limits our working power in some of the areas in the hospital.
So to be clear, Doc, the reports of mass resignations in St. Luke's is not true.
It's not true.
But I guess, Doc, this arose
Correct.
because of reports that several groups of health workers are threatening to resign or threatening mass action over unpaid allowances. Hindi po ba?
Yes, there are news about that. But remember that St. Luke's has always, we've cooperated with DOH. We have, for example, the SRA. We have given the full SRA of our workers. People have to remember that SRA is not the only money that's being given to healthcare workers. They are now contesting the allowance, meal allowance, and transportation allowance, which is the issue now. So the issue is not between management or the hospital. The issue is between DOH and the workers. So with regards to the private institutions, we have no problem with what we give our employees and our healthcare workers.
Final words, Doc, and I guess your message to the public: is the ER still open? Is St. Luke still accepting COVID patients?
Yes, I just gave you the statistics. So as I said, it's very fluid and very dynamic. When we get free beds for both our ICU and COVID, then we admit the patient. But if you come to St. Luke's and there is none, then we will still admit you to our capacity, whatever capacity we have. and then you just will need you just need to wait for an available room. Otherwise, we give you an option of going somewhere else. But otherwise, we will not turn people down if they really need hospitalization. You will just have to wait in the emergency room.
Thank you for your time, Dr. Benjamin Campomanes, the Chief Medical Officer of the St. Luke's Medical Center. Good evening, Doc.
Thank you.